Hello, this is Dr. Mike Chu, a physical therapist, and yes, I'm your alternative career coach. Today, we'll be interviewing one of the speaker in our virtual geriatric rehab summit, Clarice Grote. Will be back in a few seconds, okay?
HelloNote is a truly therapist-friendly practice management solution with integrated EMR that will enhance workflow, efficiency, and patient care. HelloNote reduces error and allows you to spend more time with your patients. It comes integrated with billing. Claims are generated once a note is completed. You can bill with one click and a patient portal, which streamlines the patient intake process. Beautifully engineered and cloud-based for easy accessibility, the software works on all platforms. You can access patient records from anywhere. We also offer 24/7 support. HelloNote is the practice management solution that you're looking for.
All right, we are back, ladies and gentlemen. Before I keep on going, check out medbridgeeducation.com. Use the code alternative. You get 40% discount, not just 10, not 20, not 30, but 20% discount. Again, if you're watching live, comment live. Watching replay, comment replay. Today, we have a special guest. Our guest is one of the many awesome speakers in our virtual geriatric summit headed by Carol Welke. But our guest for today is Clarice Grote Miller. She's the Chief Executive Officer and founder of Amplify OT. We're going to ask her what this Amplify OT does and how can they help you find your alternative career and how you become awesome. But without further ado, let's go ahead and bring in Clarice. Clarice, what's going on in the neck of your woods, or whatever you call that? So what's going on? How are you?
I'm doing good. How are you?
I'm doing good. So could you please tell us who you are? What do you really do in Amplify OT? I mean, and then how can you help us be amazing like you?
So I'm Clarice Grote. I'm an occupational therapist. I am the CEO and founder of a company called Amplify OT. I started it in 2020, and this is now what I do full time. So I consider myself a healthcare consultant. But primarily what I do through my company is I provide easy to access resources on Medicare policy, healthcare quality, federal legislation, advocacy, basically all the information that you need to be an excellent practitioner, that information that you need to excel to perhaps get that non-clinical career, and just kind of help explain the role specifically of OT in our traditional medical model, but also applies to other rehab professionals as well. So I provide articles, podcasts, CEUs, all those sorts of things. Just I take the policy and I make it relevant to our practice as practitioners.
Wow. So you're the person we're trying to look for, huh?
I hope
So
so.
what made you decide, where are you located right now? Are you
I'm in
location
North
independent?
Carolina.
North Carolina.
hmm
So let me ask this. What made you decide to do this full time? I know we're in this podcast, we're trying to promote the Geriatric Rehab Summit, but I want to ask you first, what made you decide to get out of the clinical care and then now you're doing, technically non-clinical stuff, you're doing podcasts, you're doing shows and speaking engagement. What made you decide? Are you burnout like me or just awesome like you? I mean, how does that work?
So I actually had a field work at the American Occupational Therapy Association as a student. So I did a level 2 field work. And so for OT, that's 12 weeks of an intensive, basically internship. And so I worked with the federal affairs team in AOTA, which is where I really learned a lot about the ins and outs of policy and advocacy and how exactly it impacts our practice. I've always been interested in politics and learning about those sorts of things. And so then once I got my degree in OT, it just made a natural transition for me to focus more on health policy. I've always been interested in it. I've been the advocacy and policy coordinator for AOTA for the Home and Community Health Special Interest section. I've been the director of practice for the Missouri Occupational Therapy Association, written a lot of articles for AOTA, primarily about home health. And so it's just always been something that's interesting to me. So I liked patient care, but I liked doing policy work more. And so while I was a full-time clinician, I still worked in these policy roles. And then, I did get burnt out a little bit. I worked in a hospital the last 2 years, so seeing COVID patients and dealing with all that transition. And then when I moved from Missouri to North Carolina this past year, I had to quit my job because I moved. And it just made the perfect transition for me to move into this full time and take on consulting work and CEUs, guest lecturing, all those sorts of things. So I'm just in a very fortunate opportunity to be able to pursue this field full time.
Oh, that's amazing. Well, it sounds like you got so much experience already doing all this stuff here, but you look so young. I mean, is it really what you call it? Is it really necessary for us to get out of the healthcare field, or would you still recommend us, doing clinical care? What do you think?
I think it's both. We need people both in clinical care, and need people both in non-clinical roles. So I do only have, 4 years of experience. I finished school in 2018, so I'm still considered fairly new to the field, but I've worked really hard to get to this place and learn all the things that I know. I think we need great practitioners, and that's what I hope to do, is support people to be great practitioners, and help them learn the things that they need to know to succeed in these new payment changes like we've seen in SNF and home health. There's lots of great opportunities still for therapy to thrive in these value-based care models. And that's what I hope to tell people, is that you don't have to constantly feel like you're fighting a system, that you can succeed if you know how the system works, if you have the directions to know where you need to go. But then we also need those amazing practitioners to be in these non-clinical roles, because that's the way that we're going to make a lot of change. We need people to be the change that they want to see in the healthcare system, and I hope to provide them with the resources to help get there.
Amen. Amen. That's so true. I like what Clarice said. You know, there is just even in the Bible. I know if you're watching live, comment live, watching on the replay, comment replay. Even the Bible itself, not everybody can be a pastor. Not everybody can be a
Right.
preacher. And the Bible says we all have different parts to do. Even the human body. The eyes cannot be the mouth cannot be the ears, right? The ears cannot be the feet. So you just have to do your part, right? You do your part. If you're a great clinician, go ahead. But here's the thing, ladies and gentlemen, you can be a great clinician, and then if you get promoted, you can be the worst boss in the world. And then you've got an amazing manager, director of rehab, and then you put them in the clinical stuff, they'll be like the worst clinician. So we all have different talents, okay? That's why I always say, if you want to find your alternative career, go back, go dig inside what is it that you're passionate about? What is it that you really want to do? And then go from there, okay? And that's what Clarice is doing. She found her passion in creating policies, and that's what she's been doing. So, Clarice, so right now you said uh, you're writing policy. I mean, how does that work? I mean, seriously. I mean, I don't know.
So I don't write my own policy. So what I do primarily is I take Medicare resources. So I go straight to the source of CMS, as well as with AOTA, APTA, and read those resources. So like, I read the final rule that came out from home health and looked for what it meant for occupational therapy. And then I take that policy speak and turn it into practitioner speak, because we do kind of speak different languages. We have different jargon. And so I try and translate, okay, this is what CMS says we have to do as practitioners. Now, this is what it means for your practice, or this is what PDPM pays for. This is what it means for you. And so I write those kinds of articles all about PDPM, or how to score Section GG and why it matters. Why does accurate scoring matter for quality outcomes? How does it impact how much you get paid? Right? Because if we aren't billing accurately, if we aren't scoring our quality measures accurately, you're not going to get paid accurately. So we always want to be a successful career. But if we're not doing our due diligence and doing our side of making sure that we are accurately providing services by what the law says, then we aren't doing what we need to in order to make therapy professions a sustainable career and a successful career. And so I write articles on that. But I do also participate in advocacy, calling legislators and asking them to pass certain pieces of legislation. Like, we've got the SMART Act about the OTA and PTA modifier currently in the House. We've got the Allied Workforce Health Diversity Act. We've got, there's a TRIA Act talking about revamping the Impact Act from 2014. There's lots of different pieces of legislation, and that's where it starts. So Congress writes the legislation that then dictates what Medicare does. So if you have to pay attention to what's happening in Congress, because once it passes through Congress, it then goes to CMS, where they put through proposed rules and final rules where you can comment. And then once it goes through that process, it then comes down to us as practitioners, and as business owners to implement that policy. We've seen that with the No Surprise Act that just passed this last December. And so these things that happen in Congress do trickle down to impact OT and PT and speech, whether it's within a few months, like the No Surprise Act, or a few years, like with the Balanced Budget Act of 2018. That's what required the PTA and OTA payment differential. We're not seeing that hit practices until January 1st of 2022. That's a 4-year gap. So we have to pay attention to these things. And that's what I'm hoping to tell people is, we need to pay attention early and that you can make change. It just takes time and a little bit of effort, but then I'm here to try and help bridge that gap so you don't have to do all the research on your own. You can just go to my articles and learn about it, how it's going to impact your practice in an easy to understand format. And then also I have links. I always cite the CMS policies or additional references if you want to learn more or if you want to go directly to the source, because CMS is always going to have the most accurate information because they're the ones writing the rules for Medicare.
Wow, that is so amazing. That's so amazing. Again, thank you very much, Clarice, for stepping up. And for doing this, not only, I mean, you're doing this not just for yourself, you're doing this for a bigger purpose. And that's what I've been telling our group, whether you're watching in the Alternative Career Group or in the Virtual Therapy Summit or Virtual Geriatric Summit. You have to find something that is bigger than you. What's your bigger purpose? And that's what Clarice did. She found a bigger purpose. I mean, this is definitely a big undertaking. So, thank you very much, Clarice, for stepping up. Clarice, where can we find you, and what will be the topic that you're going to be talking about on the Virtual Geriatric Summit?
Yeah, so for the Virtual Geriatric Therapy Summit, I'm presenting on Thursday at 3 p.m. Eastern about value-based care and post-acute care reimbursement. So talk about what is value-based care, what does it mean for our practice, how is it impacting us as clinicians, how has it changed our healthcare system, and then also going through kind of the basics of how Medicare pays for therapy services in post-acute care. So post-acute care includes long-term care hospitals, inpatient rehab facilities, skilled nursing facilities, and home health. So that means we're going to be talking about PDPM and PDGM, Section GG, quality measures, all those sorts of things. It's a lot of stuff to fit into an hour and a half, but I think we can do it. And so that's where you can find me at the Virtual Geriatric Summit. I also will have a booth that you can come by and talk to me at. So I'll be there during the presentations and during the summit. In terms of where you can find me outside of the summit, I am on pretty much every social media setting. I'm primarily on Instagram and TikTok, Pinterest, Facebook. amplifyot.com is my website. So that's a great place to find all my resources. I have the Amplify OT podcast that's on pretty much every subscription service. And those are just the ways to find me. You can also email me at cgrote@amplifyot.com, or you can contact me through my website. So lots of different ways to get a hold of me. I offer coaching services, OT resources, all sorts of stuff, just anything I can do to help you understand your role in this system and how to be successful and how to advocate for change, because just saying it's not fair doesn't really work. We have to have the evidence with us.
Oh, I love that. I love what she said, ladies and gentlemen. Again, thank you very much, Clarice. I appreciate you. I love what Clarice said. You just can't tell everybody it's not fair, but because life is literally not fair. I mean, if I wanted to be fair, I wish I could. My height would be like 6 feet, right? I want to be tall. I'm just like 4 or 5. Just kidding. I'm 5'6". So, but still, I want to be taller, right? But that's not fair, right? But like what Clarice said, you got to do something about it, okay? But before I let you go, I keep on going. Oh, I know she's very busy. We were actually late. But before I let you go, always remember the word FAST, FAST, letter F. Find people that will bring out the best in you, because you are the average of the 5 people you hang out with. Right now, I hang out with Clarice. I feel like I can be like, someday I want to be like a policy maker or talk to the politicians. I want to be, I want to talk to politicians, talk about my immigration stuff, right? So find people that will bring out the best in you. Next letter is letter A, take action. All this stuff that we're doing is not going to do me good. It's not even going to do Clarice good if you don't take action. That's what she's done. That's what she's doing. She's taking action. She's amplifying occupational therapy. She's taking action, right? Next letter is letter S. Share, subscribe. The more shares, the better, right? Because it may not be applicable to you, but it could be applicable to someone else. Share her website, amplifyot.com. Go to her, talk to her, email, reach out and email her. See, I'm running out of English, Clarice. Stop it. Talk to her, email her. Who just talk to your email. Email her at cgrote@amplifyot.com. And last but not least is letter T, is teach it. Why? Because when you hear it, you forget. When you see it, you remember. But when you're actually teaching it, that's what Clarice is doing. She's teaching us. She's coaching you. The more you teach it, the more you understand it. Again, thank you very much, my Facebook friends, YouTube friends who were watching Virtual Geriatric Summit. Clarice, any last parting wisdom for our group?
I think exactly what you said. Don't be afraid to take action. Advocacy can be easy. Policy can be easy. And I am here to prove that it's true.
All right. Oh, gosh. I am here to prove that it's true, right? Again, thank you very much, Clarice. Thank you very much, Virtual Geriatric Summit, and the rest of the people who are watching. And be awesome, be great, be excellent. And we'll see you around tomorrow. We'll be back tomorrow. Thank you. Bye-bye. Thank you, Clarice.
HelloNote is a truly therapist-friendly practice management solution with integrated EMR that will enhance workflow, efficiency, and patient care. HelloNote reduces error and allows you to spend more time with your patients. It comes integrated with billing. Claims are generated once a note is completed. You can bill with one click and a patient portal, which streamlines the patient intake process. Beautifully engineered and cloud-based for easy accessibility, the software works on all platforms. You can access patient records from anywhere. We also offer 24/7 support. HelloNote is the practice management solution that you're looking for.